So let's briefly have a lecture on the stages of labor. So labor is a process by which regular, painful uterine contraction cause progressive effacement, that's thinning, and dilatation, that's opening of the cervix, leading to the expulsion of the fetus, placenta, and membranes from the uterus through the birth canal. So the key points to note is that it occurs after the age of viability, usually after 28 weeks of gestation in many settings. It involves three essential events, which are uterine contractions, that are usually regular and painful, cervical changes, that's effacement and dilatation, that's thinning and opening, expulsion of the fetus and placenta. The stages of labor are divided into three main stages. Some texts add the fourth stage. Here is a clear breakdown. The first stage is cervical dilatation. It begins from the onset of true labor pains to full dilatation of the cervix, which is 10 cm. It has two phases, which are the latent phase and the active phase. The latent phase, here the cervix dilates slowly from 0 to about 4 cm. Contractions are mild and irregular, may last up to 8 to 12 hours, especially in first time mothers. The active phase, the cervix dilates rapidly from 4 to 10 cm. Contractions become stronger, longer, and more frequent, usually lasts 4 to 6 hours. Second stage, which is expulsion of the baby, that's from full cervical dilatation of 10 cm to delivery of the baby. The features are strong, regular uterine contractions. Woman feels the urge to bear down, that's the urge to push. Fetal head descends through the birth canal. The duration in primary gravida, that's first time mothers, women giving birth for the first time, is 30 to 60 minutes. In multipara, women who have given birth multiple times, is 10 to 30 minutes. The third stage, which is delivery of the placenta, that's from delivery of the baby to complete expulsion of the placenta and membranes. What are the features? Here, uterus contracts firmly, placenta separates and is expelled, held by controlled cord traction. Duration is usually 5 to 15 minutes. Watch for postpartum hemorrhage, PPH. The fourth stage, which is optional, is immediate postpartum period. This is from delivery of placenta to about 1 hour postpartum. The features are observation period for maternal stability. So you check if the mother's vitals are stable after giving birth. You monitor for uterine tone, bleeding, blood pressure, and pulse. This is the critical period for detecting postpartum complications such as hemorrhage. Thanks for listening.